Hello, I'm Dr. Leon Popovitz. Welcome. Today I'm going to answer the question, should I have my meniscus fixed? I get that asked very, very often. To start, what is a meniscus? A meniscus is a cushion of cartilage between the two major bones in the knee joint. This is a model of a knee. This is the top bone of your knee joint. This is the bottom bone of your knee joint. And this is the kneecap. At the ends of the bone, in the joint itself, is a smooth layer of cartilage. It's kind of like an eggshell, and that's called articular cartilage. In between the two major bones are cushions called the menisci. There's a meniscus on the inside of your knee called the medial meniscus, and there's a meniscus on the outside of your knee called the lateral meniscus. These menisci protect the articular cartilage. If the articular cartilage wears away or cracks off, bare, rough bone shows, and you have bone on bone, and that's arthritis, where there's no lining protecting the ends of the bone. So the question remains, should you have your meniscus fixed? The answer is depends upon what kind of meniscus tear you have. If you are a little bit older in age and less active, and you did not have a traumatic event, you didn't twist your knee, you just developed gradual discomfort in your knee, that's probably as a result of a degeneration or a degenerative meniscus tear. If you have a documented degenerative meniscus tear that does not interfere with your ability to straighten your knee, and it does not cause buckling, doesn't make you fall or lose your balance, very often you should and you could try conservative non-operative treatment, such as physical therapy, bracing. You can try injections such as cortisone, or even better, stem cell or PRP plasma injections. You can try some medications, but very often a degenerative meniscus tear, the pain in a degenerative meniscus tear gets better with time and conservative treatment. If you have a situation where you're younger and you twisted your knee or you had some kind of traumatic event, that more likely is a acute traumatic tear. If you have acute traumatic tear and you're younger in age, we take that very seriously because that meniscus, that cushion between the two bones, protects that articular cartilage. It protects you from developing arthritis. So more often than not, if you are a young person with a documented traumatic meniscus tear, we often proceed with repair. And we often make every effort to actually repair it, to fix it back to where it needs to be to allow it to heal. We want to preserve your joint. You're born with a certain amount of cartilage. You don't get more cartilage. So we want to preserve your joints. That's really the key to any kind of musculoskeletal bone and joint longevity. It's the key to any kind of longevity, really. The focus is on preserving what you have. So if you are in your 20s or 30s or most young ages and you have a traumatic event that caused that meniscus to tear, more often than not we look to fix it and we look to repair it. Meniscectomies or removal of the meniscus is something we really try to avoid in younger people. Other indications for a repair or surgical procedure for a meniscus is if you have a displaced tear of your meniscus that interferes with your ability to straighten your knee or interferes with your stability. For example, if this meniscus tears off, the entire structure tears off and is sitting in the front of your knee like this, it'll interfere with your ability to straighten your knee. That often is indication for surgical repair, because if we don't relieve that space and allow you to freely extend your knee, that might be a problem as time goes on in your ability to straighten your knee, even if the surgery is done later. So that's usually a timely sort of thing. If your knee is buckling or you're feeling your knee unsteady, that's often also an indication if you have a traumatic meniscus tear. Now, some patients suffer what's called a meniscus root tear. The meniscus root is the actual attachment of the meniscus to the bone, deep inside the tissue, deep inside the bone itself, in the joint itself. That root can tear off of the bone in a couple of different circumstances. Some people with degeneration of the joint may suffer a root tear where that attachment to the bone of the meniscus comes off, just like a tree has a root. The meniscus has a root that attaches into the bone. That can tear off, and somebody might feel a sudden pop in their knee or sudden pain in the knee without any traumatic events, without twisting the knee, without any inciting events. That can very often be a meniscus root tear. Sometimes younger people can develop a root tear from trauma as well. If you have a meniscus root tear, an important fact to understand is that studies have shown that a root tear, if it is not fixed, can lead to an accelerated progression of arthritis, meaning that you may develop arthritis at a very fast rate. And that's why very often meniscus root tears are fixed in younger people who have had traumatic causes of that, or even older people from degeneration that have developed that tear from degeneration, because if the tear is in the actual root in of itself, not the body, you're going to end up potentially getting very significant progression of arthritis. We want to avoid that. So we want to preserve your joint. So if we see there are certain injuries, certain type of pathology, certain kind of situations where we see that you may develop arthritis prematurely, that's when we usually decide that surgical intervention is warranted, and we can actually repair the root back into the bone itself. So again, there's a lot of different types of meniscus tears. There's a lot of different types of getting a meniscus tears, and depending upon the type or where you got that meniscus tear guides us in determining whether or not you need meniscus surgery. I'm Dr. Leon Popovitz. Thank you very much.